Of course,
I
monthly.
think we can
We
finally
can start.
restart this whole thing. All right.
Oh,
So sorry to our viewers. Let's try again. Bismillahirrahmanirrahim. Hayati, the
okay.
floor is yours.
All right. Okay. Thank you so much, Alif. Okay. Bismillahirrahmanirrahim. So, having bipolar disorder doesn't mean you're broken. It means you're so strong and brave for battling your mind every single day. Assalamualaikum and a very good day I wish to all of you. Thank you so much for joining us and welcome to our webinar for Professional Speech Communication 3090. I'm Hayati Baki with my friend.
Muhammad Alif.
We are communication students of IUM Gomba and we are your moderators for today. So today we are excited to focus, to highlight and to discuss a very fascinating and interesting topic, that is bipolar disorder, disability inclusion, the bipolar disorder perspective. And I'm sure that everyone here has heard of bipolar disorder, but some might confuse bipolar disorder with other psychological disorders, and some might not so acknowledge and be aware of it. Thus, today's webinar will give you a clear explanation on what exactly bipolar disorder is and how it is different from other psychological disorders. And together we can understand how bipolar disorder can affect one's life to the extent that it can be considered as a disability. And this topic will also help to clear up any misconceptions about the disorder. And we can also listen to real experiences, real struggles from our bipolar disorder survivor. And as a community, we can learn how to help make everyday life more inclusive of those with this disorder. And with that, we are very honored to welcome both our special and reliable speakers today. We have uh, Puan Anita Baka and Sister Arisa Sofia in the house. So please welcome. Hello, Assalamualaikum Puan Anita and Arisa.
Waalaikumsalam warahmatullah. Hi,
So how
hi.
are you, Puan
Waalaikumsalam.
Anita?
I'm well, alhamdulillah. How are you?
Alhamdulillah. Good as you can see. And Sister Arisa, how about you?
I'm great, alhamdulillah, thank you.
Alhamdulillah, glad to hear that and great to see you both in a very ping of health. So people say that not knowing is hence not loving, or Malay people say tak kenal maka tak cinta. So let me introduce to you guys our both special speakers today, and we will go first with Puan Anita, shall we? So Puan Anita is a very great figure, an incredible person who continuously associate people and spread awareness on mental health issues among our society. She was the founder of MIASA, and for those who didn't know, MIASA stands for Mental Illness Awareness and Support Association Malaysia. So, Puan Anita, we would love to hear more about you. Could you please brief to us about yourself and also introduce MIASA Malaysia?
All right. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Hi, everyone. Thank you so much, Hayati, Alif, and hi, Arisa. As mentioned by Hayati, I'm the president and founder of MIASA. We are a mental health advocacy and peer support group. And I'm a person with lived experience. I'm a person with a mental health condition, hence why the birth of MIASA came about 9 years ago when I was diagnosed. I was in a really bad place, and it was very challenging for me to get help during the time. If we remember, 5 6 years ago, there wasn't a lot of awareness on mental health, and a lot of it actually were done by mental health professionals, but it really didn't spread out much. And so when I was granted back my health, alhamdulillah, that was when I was inspired, because of my own experience, and what I've learned, to really, create a platform where people, hopefully, inshallah, didn't have to go through the difficulty and challenges that I went through. I also wanted people to feel safe, to be able to, disclose their challenges, and assert their identity, hence able to go through that recovery process effectively. And so the conceptualization and birth of MIASA happened. So with Miasa, what we try to do as much as possible is obviously to spread awareness, to promote, the importance of mental health, and also to um, correct the many, negative perception or inaccurate perceptions of the public, because majority of people have a certain perception when it comes to people struggling with mental health conditions, and usually, and obviously it's negative, right? There's a huge negative connotation when it comes to mental health disorders, etc., and especially people struggling with it. And I feel, and of course, it's of utmost importance for people with lived experience to provide that insights. So hopefully, it will translate to better understanding, better support, better treatments, and taking away that shame and taking away that fear, so that people can get the help that they very much need and require. So that is the role and importance of Miasa. We also support people with mental health conditions, both via relief support and also livelihood support. And of course, the huge chunk of what we do is advocacy. And our vision, our goal is very much two, which is helping people and saving lives, inshallah.
Okay, thank you so much, Prananita, for the introduction. Next, we move to our next speaker, Sister Arisa Sofia. As you can see, Sister Arisa Sofia is a pretty girl with a very strong and brave personality that she's willingly here to share her opinions, to share her thoughts, to share her real experiences battling and struggling, dealing with bipolar disorder herself. So, Sister Arisa, mind to share a bit about yourself?
Alright, hi and assalamualaikum everyone. My name is Arisa Sofia binti Junaidi. I am 20 this year. And I am also a bipolar disorder survivor. So I have first been diagnosed with, before bipolar disorder, I've been diagnosed with major depressive disorder, MDD, back in 2020. It's like in the middle of the pandemic, during the MCO, the first MCO. So it was at first really hard for me, but now I realized that by sharing my stories, I hope I can bring more awareness and make people know that it's okay to step up, and telling your story is not a thing as weakness. It's actually, vulnerability is not as weakness. It actually makes you stronger than you think. So I hope I can, share my story today and make people be more educated about mental health conditions, especially bipolar disorder. So yeah, that's it.
Okay, inshallah. Thank you so much for both of our speakers for an eye-opening introduction. So we are great. It's a great pleasure to work with you guys this morning, and we are really looking forward to this topic, because we believe that today's topic will be very useful and beneficial for all of us here today, inshallah. But before we dig into our discussion for today, I would like to brief a bit for today's session. So today, this webinar will be conducted for an hour, which for the first 45 minutes, we will have a sharing session, discussion for both of our speakers alternately. And for the remaining 10 to 15 minutes to the end of our session, we will open a Q&A session to provide our audiences, attendees, a platform to drop their questions or any inquiries related to this topic. So we welcome your attendees to drop the questions in the FB comment, and we will read out your questions when Q&A session has begun. And we fully appreciate if you can provide questions to a specific speaker, so it will be much easier to point your questions to the appointed speaker. So without further ado, without wasting any time, I am sure everyone are so excited to listen to today's topic. So with that, I pass this mic to my friend Ali, who's very far in London, to proceed with our next agenda. So please welcome Ali.
All right. Thank you so much, Sister Hayati, for kicking off our webinar session today. And thank you again so much to both of our wonderful guests, Puan Anita and Sister Arisa, for being here today, and we are beyond honored to have both of you here. And so, without further ado, I would like to just start off with talking about mental health awareness in general. So, as we know, mental health awareness has been improving gradually in recent years, right? As a result, people have been more exposed to mental health disorders such as depression, anxiety, ADHD, right? And a lot of that is from the media, actually, social media, or like the media in general. We see in television shows and in movies today, there's a lot of representation for people with mental disorders, right? So, with that in mind, can you please tell us, maybe Puan Anita first, can you please tell us what exactly is bipolar disorder and what separates it from the other psychological disorders?
All right, thank you very much, Alif. Firstly, I would like to apologize. There's some construction work going on. If you hear the noise here. Okay, so first and foremost, there are many mental health conditions or mental illnesses out there. And obviously, bipolar disorder is one of the many. But the most common mental health conditions are anxiety and depression, obviously. So it's good that we're having this discussion on bipolar disorder because obviously there are a lot of misconceptions about this disorder. Even anxiety and depression, there's so many misconceptions. What more a condition that is maybe not familiar to others? And of course, there's so many reinforcements done, especially in the media, which gives obviously the public an incorrect understanding of the condition as a whole. So, bipolar disorder is a mood disorder. When it comes to mood disorders, usually what we understand is depression. But bipolar has two extremes. So one is the low, which is depression, and then you have the high, which is mania or manic. And then you also have the normal phase in between of these two extremes. And usually, when in Miyasa as a whole, we have many peers with bipolar disorders. So it's really interesting because bipolar disorder peers are really intelligent people. And it's really wonderful to be able to hear their stories and experiences. So when we talk about bipolar disorders, there's a couple of different disorders under that umbrella. So typically we will talk about bipolar 1 or bipolar 2. So when somebody is in a manic or a depressive phase, these phases can last quite a bit, quite a while. Yeah. It's not like you're high today and tomorrow you're low. It is, as an example, you could be depressed 6 months, and then you can also be in a manic phase for 6 months as well. What is important is when you're in these phases, that you're able to not go to an extreme end, because if you're really depressed, and then it's also very easy to be really high at the same time. So when you're in a depressed state, it can be very debilitating as well if you're not able to manage it, if you don't understand your symptoms. Hence why knowledge is it's transformative, obviously. So in whatever, condition or mental health disorders that you are experiencing, is for you to really understand what your symptoms are and how you're able to manage, these different phases or emotions and symptoms. So when you're depressed, you might feel you want to isolate yourself. Your energy becomes really low. You're not able to do the things that you would typically do, or it's easier for you to perform, or go through your daily routine. As an example, you feel really sad, you feel really depressed, you feel that you're not worth it, people don't love you, for example. And if you come to an extreme low, you will also battle, as an example, suicidal thoughts and ideation. And these symptoms are very intrusive. This is something that I hope we can all understand and realize, because if not, there's a lot of stigma and taboo when we talk about, the topic of suicide, right? So it's really intrusive in the sense where when someone is battling it, it's like as if when you're sick, how your body temperature increases. You get probably a cough, you start coughing, or you get a cold as an example, and you can't stop these symptoms from coming. Similarly, when you're going through depression or in a depressed phase, you can't stop from these symptoms from coming, which in this case is suicidal, in relation to suicidal thoughts, ideation, in this context. Yeah. And if you're in your manic phase, usually what happens is you feel very impulsive. Sometimes there are elevation in your self-esteem, so you become grandiose, for example. You talk really fast, you have a lot of ideas. You don't really want to sleep, because you have an excessive amount of energy, as an example. So these are some of the symptoms of these two extremes of depression and mania. So it is a mood disorder, but you are able to recover and lead quality and normal lives if you seek knowledge, you understand how to manage these symptoms, you have effective coping mechanisms, and the approach to your recovery process is a holistic one. So, inshallah, hope that helps.
All right. Thank you, Pranita. Uh, Thank you, Pranita. What about you, Sister Arisa? As a bipolar survivor yourself, how would you describe the disorder? Is there anything else you would like to add to Puan Anita's explanation?
I think Juanita has described it very well. So I'll just like go off with telling my own experience dealing with bipolar. So as I mentioned, I've been diagnosed with bipolar disorder type 1. So bipolar disorder type 1 is diagnosed when a person experiences a manic episode, just like what Juanita said. So for me, my symptoms was that I was very energetic. I wanted to talk a lot. I wanted to spend a lot of money. In like not by planning how to spend the money, just like on random things I would spend my money on. I remember I spent it on like groceries, and mind you, I don't really know how to cook. So suddenly I wanted to do like Japanese cuisine or Italian cuisine. It was so random, but back then I wasn't diagnosed with bipolar disorder yet, so I didn't know it was one of the symptoms. I thought at first I was diagnosed with MDD, depressive disorder. So I thought I was actually getting, better. Like I was feeling better. I was feeling euphoric. So I think, wow, I am finally not feeling sad anymore. But I didn't know it was actually mania. So what lead me to getting a diagnosis was I had to be sent to the hospital to be warded because I was facing a lot of dangerous symptoms. Like I was firstly it started with like delusions, and then hallucinations. I started to hear things that aren't there, and I become dangerous to people around me, to my family specifically. So both of my parents had to send me to the emergency department, and I had to stay in the I had to be warded for a few weeks, and then I got my bipolar disorder 1 diagnosis. So it was not like an easy way to get my diagnosis, and I didn't even expect that I was diagnosed with bipolar disorder. But sometimes things just happen. So, but I'm very grateful that at least I have my diagnosis. So now I know how to control it better, how to manage it better, and how to cope with it. So yeah, that's my point of view.
So, from that explanation, we can conclude that people who suffer from bipolar disorder obviously have to deal with so many conflicts, especially from like an emotional standpoint, right? So, with that in mind, what are some examples of like your everyday hardships that a person with bipolar disorder would have to deal with on a daily basis, to the point that it can become as you can qualify as like a disability, right? Something that wouldn't apply to the average person, something that the average person wouldn't have to normally deal with. Sister Arisa.
So I think what can bipolar be till disability is that we are facing symptoms like trouble concentrating. So when maybe we're in a manic episode, we have trouble concentrating because we have racing thoughts. So we just have like this all thoughts that until we couldn't sleep, couldn't get a normal cycle of sleep. So, and then like maybe when we're in another episode, which is the depressive episode, we wouldn't concentrate because there is too much thoughts in our mind that it becomes really hard for us to concentrate, especially for me at least. During studying, maybe I couldn't process what my lecturer has taught me, or I couldn't even attend my daily classes because maybe I am too depressed to even get up from my bed. So and I think I have also worked for a short period of time before I think it was like after SPM, and just before I started back to study in college. So for me, I think I know that there are bipolar disorder patients out there that can can keep their job for a long time, but for me it's really hard for me to work the same amount of the same job for a long period of time, because for me things would get very overwhelming for me. So I think that is one of the hardships that we have to face when we have bipolar disorder. Hmm.
All right, thank you, Sister Arisa. And for you, Puan Anita, in your years of experience working in Miasa, what are the challenges that people with bipolar disorder face that you've observed firsthand?
Okay. I think that stigma is really one of the things that, peers face a lot, especially when it comes to those struggling with bipolar disorder and also schizophrenia disorders, because of the inaccurate portrayals in movies, dramas, that people draw this conclusion about them. So the stigma really makes them feel ashamed and afraid, and that is why a lot of times they don't feel supported in the workplace. They feel afraid to assert their identity, and it becomes obviously challenging, right? Because even for a person like me, pretending that you're normal amongst the normal people, that's the hardest thing to do. It takes up a lot of energy, and I feel that a lot of times we, you know not only people with bipolar disorders, but anyone in general with any kind of mental health condition face the same thing. So hence why I always say stigma is really the true poison of it all, because it really hinders a person from their recovery journey. It robs them from that recovery that they can actually go through more effectively, given that support and acceptance by society, family, and also friends, obviously. Yeah.
All right, thank you. So, speaking of stigma, what are the biggest misconceptions or assumptions about BPD that you have heard or experienced? Maybe Arisa can answer this one first.
Okay.
Alright. So I actually have a lot. So I think I'll start off with like one of the biggest myth is that bipolar disorder is just mood swings and everybody has it. I think that is very, very incorrect, because some people just lightly use the word bipolar, like, oh, why are you feeling sad? Just now you just like felt happy, right? Why are you feeling sad now? You're so bipolar. I think of course it annoys me, but I think what annoys me more is the fact that that kind of fits into a stigma where it's very inaccurate, because bipolar disorder is like an extreme mood, and it occurs for a long period of time, maybe days, weeks to months. It's not just like a 1 second thing and then you can switch to another mood. That is not bipolar disorder. And bipolar disorder is very hard to be diagnosed also. So you shouldn't take it as lightly. And another myth I think is that when you are having a manic episode, mania, you are fine. Like that is a good thing to be. And I think as someone who was type 1, which I was diagnosed because of manic episode, I would not necessarily say it's fun. It could be traumatizing, not just for me, but also for people around me that has to literally force me to go to the hospital, to the emergency department, because I was being very dangerous to everyone around me, and I was having some sort of delusions at that time. I was feeling like I was sent by the god, and I was having some sort of hallucinations where I hear things that are there to tell me to, oh, you should hurt these people, oh, people are coming to attack you, and that is not fun. I don't know what kind of fun you can describe it, but I don't think that's fun to be. And I just feel like, mania is just as bad as depressive episode. So you shouldn't romanticize mania in a sense, because it could just be as traumatizing as your depressive phase. So yeah, that is two of the biggest myths that I have heard before, and I hope that the society in general in Malaysia especially can change that and be more educated before you use a particular word like bipolar. It's just the same as if you use the word OCD, you're so OCD. I think that just fits more into stigma. So I hope the society can do better. Yeah, that's it.
All right, thank you, Sister Arisa. Upon Anita, is there anything you would like to add? Any misconceptions that you yourself would like to debunk, or maybe
Sure.
there are some things that that people out there should avoid saying in case they might offend anyone with BPD? Yeah.
All right, thank you. I think Arisa raised a really good point, which is not using clinical terms loosely. So language is really important, and I feel that, and I say this a lot, where we should increase our mental health vocabulary. This is so important because, people don't do it deliberately. In that sense, but because of the lack of knowledge, the reinforcement of stigma comes in, and if we have that knowledge, then we can combat stigma, which is really helpful because that contribution will really help in our strive in the reduction of stigma, right? So I think Arisa gave a really good example, because typically we use the word depressed loosely, we use the word OCD loosely, right? So let's be mindful in our words, because when we do that, we are helping to advocate for mental health, and people that are struggling with mental health condition, using the terms correctly. I think when it comes to misconceptions, Arisa, obviously being a person with lived experience, shared it really well, and I think that being in the manic phase, a lot of people think or have the perception that it's good, you have a lot of ideas, you're really creative at that moment, but people don't realize there's it can be also very debilitating, it can be very tiring to be in a manic phase as well, and you also feel like you're losing control in that sense, especially if you are in that manic episode. And of course there is that spectrum as well, right? So you've got your different levels of hypomania and mania, in that sense. And I think the other misconception is always, people with bipolar disorder can't recover. We can't go back to normal functioning. And I think this is also another misconception. And obviously, or people with bipolar disorders are constantly ill. I think that's also another misconception. So, me personally, if we put in all mental health disorders together, I think the biggest misconception is actually that people with mental health condition can't recover. It's absolutely inaccurate. There's a lot of data and research that have proven even how chronic and severe a person's mental health condition is, you can actually recover from it. The definition of recovery is what we need to understand. It doesn't mean the absence of the symptoms, or you now don't have the condition anymore. But recovery means that you're able to manage your symptoms, you're able to go back to your normal functioning, where you're able to lead quality lives, you're able to go back to your routine, and even thrive in that condition, or in your life. So that's what we really need to understand when we talk about what the definition of recovery is. So maybe those of you that really want to maybe study more about this, you might want to look up the recovery model, because this is exactly what the recovery model champions and what it talks about, where a person is more than their diagnosis, they're more than their symptoms, right? So if I can give you a picture, so for example, take me as an example. So I'm a person with a mental health condition, right? So as I go along my recovery process, I then get married and become a wife. So now my condition is a half of me, and then I go through, I move on in my recovery journey, and then I become a mom. So my condition is a third of me. I then maybe buy a house, and then now I own a house, right? So my condition is a quarter of me. And then I volunteer, I become a volunteer. So now the condition becomes a fifth of me. And so as you go along your journey to recovery, you will then realize that your condition is only a dot of you. So this is what the recovery model talks about, and this is how you will understand that you are indeed beyond your symptoms. And it gives you a lot of hope if you're able to see it this way. And I've seen and I've met so many people specifically with bipolar disorders that are able to really thrive in their condition, and they are able to do so much more. And I think one of the greatest gifts that all of us with mental health condition have is the gift of empathy, obviously, which I feel in the work that we do, people with mental health conditions still go through a lot of stigmatization, which then leads to discrimination, isolation, exclusion, injustices, human right abuses, etc., coercion, especially. So I think it's really, really important to really normalizing this discussion, exactly what we're doing today. So hopefully we can improve mental health literacy, and people that are struggling can reach out for the help that they very, very much need and require, inshallah. Hope that helps.
Okay, so Puan Anita, thank you so much for your explanation. I really appreciate when you say that we hope that this webinar will help to stop the stigma of people people with struggling with mental health disorders. Okay, so regarding recovery part, you mentioned on recovery part. Yep. So I remember a hadith saying that there is a cure for every disease. There is a cure for every illness. So I would like to ask you, Puan Anita, do you acknowledge any current methods of treatment for bipolar disorder that are available today in Malaysia or in other countries, and how effective they are? And we would like to know, is bipolar disorder possibly can be completely cured? We would love to hear from you.
Okay, all right. Again, not in the definition of cured, if you mean that you no longer have bipolar. Obviously not. Because, a mental health condition is a lifelong condition. It's like, diabetes, high blood pressure, right? So you have it for life. Unless, of course, Allah subhanahu wa ta'ala takes it away, right? So that's one. But it doesn't mean that you can't cure it, that you're not able to manage or lead quality of life or quality lives. So this is the distinction that we really need to understand. There's many people with lived experience or our mental health peers that have recovered and are successful today and are able to manage and lead quality lives. It's just because of the stigma, it silences them. And so again, this is why it's really important, again, if we want change, and if the time is right, we feel brave enough, do share your story across, because it's really helpful, and it provides a lot of insights, obviously. When it comes to treatments, what is important is it must be a holistic approach to your recovery process. So when it comes to your recovery, there's really a lot of different things that needs to happen. So it's not just about going through that treatment, and treatment can be a lot of things. It could be taking medication, it could be going to therapy, it could be peer support, it could be a open dialogue kind of concept. But what is important is really that work life balance or that study life balance, taking care, especially specifically for people with bipolar disorders, taking care of your wake sleep cycle, right? So having enough sleep, sleeping on time, and then exercising really helps to channel that energy. And of course, eating well, eating on time, doing things that you like, investing in hobbies, right? Um, Self care is really important, and of course, social connectedness, spending quality time, with family and friends. If we're able to really invest in all these components on a daily, um, you know, in your daily routine, then obviously you will be able to manage, all these symptoms, and you're able to lead, quality lives. So I think it's really, really important to understand this. And of course, the other thing is the crux of the issue or the underlying issues, right? The causes must be addressed. So I'll give you a very good example. Although we're in the endemic now, so when the pandemic happened, right, a lot of people lost jobs, reduction of income or loss of loved ones, all these things. And these things must be addressed. You can't, go through that whole process where you take that medication, going to therapy, you've got support, you've got your eating well, sleeping well, etc. Everything's happening, but you don't have a job, as an example. So that solution must also be given and must be addressed. Then can only, you will be able to see that recovery going more effectively in that sense. So it's not something that can be done in a day, but it is a journey, and that journey needs a lot of support. It must be consistent, and it can be very, very difficult. But you know, even if you feel that maybe you're having a very difficult time, as much as possible try to talk it out, because I feel that when we're able to really unload what we're going through, it really helps, because that validation is really important. But of course, talk to someone that you trust, because that person can provide that validation and also that empathy and compassion that you really need. And I think this is so important. So don't just share it with anyone, because it can really worsen what you're going through, and maybe your worst fears becomes true as well, especially if you are indeed going through suicidal thoughts and ideation. So choose the people, have a good support system, learn effective coping mechanisms, and take care of your mental health every day. When you have a mental health condition, you can't be like that normal person where you sleep an hour today, you can't do that anymore. Yeah. So please invest in all these different components, and inshallah you will see that recovery process happening.
Thank you so
Thank
much,
you.
Fahmi. That's
Yeah,
I
Brother Arif, I have one question, another questions with regards of what has been explained by Puan Anita just now. And this question is for Sister Arisa. Sister Arisa. So with what has been pointed out by Puan Anita regarding treatments and so on, we would like to know, is the treatment that you received if effectively helps you to cope with your situation, to cope with what you are struggling with? So we would like to hear from you, Sister Arisa.
Okay, so the treatment I am going through, like the treatment that I went through, is actually psychotherapy and a combination of medication. So uh, I was on mood stabilizer and antipsychotics, and combined with psychotherapy. And I used to go to meet another therapy. So like I had one psychiatrist and one psychologist. So I think that combination, in my opinion, helps me a lot. And there are actually, like, there's not just only one way to recover. So you don't necessarily need to just, okay, take your medicines and then you'll be okay. No, it's a combination of a lot of things. So you have to also go out there and talk to people. I mean, like, by what I mean is that maybe your close friends, your family, talk it out, how you're feeling and all. It actually helps a lot. I used to be someone that's actually really reserved, wouldn't share my opinion on certain things, and I just don't want to. I think I was more to a people pleaser and just don't want to hurt anyone's feelings. So because of that, I become really reserved, and I wouldn't share, how I'm feeling, if I'm sad or if I'm depressed, if I'm feeling, happy. I wouldn't share necessarily. So I think that is what I learned the most, is that you have to talk it out. And medications alone wouldn't be the answer for your recovery. I mean, it is very important because it's a chemical imbalance in your brain. So you should take your meds. I mean, according to what your doctor says. But recovery is a combination of a lot of things. You also need, maybe in spirituality, you need to pray, you need to always, they say berdoa and everything. So it helps a lot. So when you can get help in any way, you grab it, not just like, oh, I don't need it because I already have this one way for me to recover. No, you have to grab any chances as much as you can get to recover. So for me, that was what is important. But mostly for me, the most important thing is that I have to accept myself, that okay, I have bipolar disorder, but that doesn't mean I am less than a human. I am important, and I shouldn't feel like I'm excluded from everyone else, because, as Juanita said, my bipolar disorder is just a dot, and it's just a part of me. It doesn't necessarily, it's not the entirety of me. It's just a dot of me. So yeah, and also I have to, like, realize that it's okay for me to feel miserable, horrible, for me to be okay. And but what's more important is that I don't lose myself at the end of the day. I know that I can, deal with it. I know I can recover one day, even though it seems very impossible. It feels like there's no light at the end of the day. Like, why am I even hoping to recover it? It is so impossible. But when you pray, when you take your meds, when you go to therapy, inshallah, they will heal you. You just have to know that there is hope, even though you can't see the hope. You know that you deserve recovery. And if you don't want to change yourself, like the way you see yourself, like if you want to stay miserable, then at the end of the day, you will still feel miserable. So you need to recover. You have to have a certain mindset. I deserve to recover. Right. So I think that's one of the way I cope with my disorder. Thank you.
Oh, is it Peggy? Okay, all right. So on that note, uh, we know that other mental illnesses, quite a few of them actually, they are hereditary in nature. So what me and Hayati and I guess our viewers like to know is that, is bipolar disorder hereditary as well? And if so, what are the chances of family members inheriting disorder, Juan Anita?
Okay, I think the first thing that we need to understand that generally, for you to be afflicted with a mental health condition, it must be multifactorial. It can't just be one component, right? So if all these factors are present, then there is a chance that you can get the condition, obviously. But one of the things that, when it comes to bipolar disorder, the genetic component can be a big contributor. Can be a big contributor. um, I think that when you look at data and research, we're looking at about 80% when it comes to genetic. But again, I really want to stress the point that it must be multifactorial, and it's not like a guarantee if your parent has it, then you will get it. Because we get these questions a lot, and I feel that it draws a lot of fear as well at the same time. But again, like what Arisa just shared, and I think she shared it really beautifully. Being a person with lived experience, obviously, it's a combination of a lot of things when you go through that recovery process, and you can recover. I think this is that hope, and this is that positive note that we want to really take away from today's forum. Yeah. So genetics, yes, but it must be multifactorial at the end of the day. Yeah.
All right, thank you, Pranita. And in regards to that, I would like to bring it back to Sister Arisa, and if it is okay, I would like to ask, do you have any other family members that suffer from BPD as well?
I actually don't have, but I do know like few friends that it's a genetic thing where their parents also have it. So it is true, yeah. But personally, I don't have any family members that also are have been diagnosed with bipolar disorder.
All right, thank you. So aside from that, Sister Arisa, we know that you faced a lot as someone who is bipolar, but we'd like to know at what age exactly did you start to feel different or start to detect those symptoms, and at what age were you officially diagnosed with your BPD? Just to refinish that point.
I think for me, my symptoms were showing around when I was 18, 19, around there. So it wasn't too late for me to get diagnosed with bipolar disorder. I know some people have went through like a lot of symptoms and then later on they were diagnosed with bipolar disorder. So for me, it wasn't too late. But yeah, I was diagnosed when I was 19 years old, which was the early of last year. And I was showing my symptoms for like I think around like 4 to 5 months. Yeah. So but it was really confusing to me because at first I was diagnosed with MDD. So I thought it was just like maybe I went through it and I was feeling better, stuff like that. So I think most of the part is that my family, people around me, my friends were the one who noticed all of those symptoms. Yeah, so that plays a huge role.
Uh, Juanita, in your experience and from what you've seen, what age groups are more frequently to experience bipolar disorder, and maybe which gender as well is more likely, do you think, to suffer from BPD from what you've seen?
Okay. BPD is borderline personality disorder. Yeah, Liv.
Oh my
So
goodness.
okay,
Ah,
great.
that's very
Just to
dangerous.
correct that. Yeah.
So, yes, bipolar, we're talking about bipolar.
Yep. Okay. So for bipolar disorder, from the work that we do and from the peers that come to us, typically it's between 14 to 21 years old. More of the young people that we see are being diagnosed with bipolar disorder. But obviously, half of all mental health disorders begin at the age of 14. So obviously, that's proven in that sense. Yeah. Um, in terms of gender, I'm not sure, and I don't know for a fact, but the majority of people that come to Miasa, it's a ratio of 70-30, right? So 70% of people that come to us are predominantly females, and the balance are males. And usually it's because females are they feel more encouraged. Maybe they're more braver to come and reach out for the help. And men, because of the stigma, obviously, because in our culture it's men up, boys don't cry. So men typically feel very afraid because again, because of the negative connotation it links to or relates to being weak, right? So a lot of men usually when they come, they are already very severe, unfortunately. So again, hopefully with the normalization of these discussions, more men, more teenage boys can reach out for the help that they very much need and require. But obviously, when we talk about certain conditions, anxiety and depression, more females, based on a lot of data and research. But bipolar specifically, in actual fact, I'm not I do not know. I don't have those numbers at this point.
All right, thank you, Pranita, and thank you both for sharing. I will now give the floor to Sister Hayati for our remaining questions.
So yep, it seems like we have not much time left for us to continue with the discussion, but we will go for our last question for this sharing session before we continue and proceed to our Q&A session. So these last questions, firstly, I would like to listen first from Sister Arisa, maybe. So, Sister Arisa, we would like to hear from you first. As you're struggling dealing with the disorder, bipolar disorder, maybe you can tell us what are your expectations towards the community, the society, to help you feel safer, to help you feel more welcome to the society as a bipolar disorder survivor fighter.
Okay. I think to make us bipolar community to feel safer, in the society, is that I think the first step is that we don't stigmatize. You may hear, some a lot of media arbitration is very inaccurate. That you will hear about how they're very dangerous to be around, how they're very impulsive. It is some of the part is true, but a lot of people don't realize that people with mental health condition, not just bipolar disorder, we are most likely to be victim of abuse and not the abuser. So, be sympathetic, be empathic, and don't straight away stigmatize. And if you have like a close friend or your family members, go through bipolar disorder, or any other mental health conditions, always accept them and always, help them, be supportive, and avoid being pushy. Even if you feel like, oh, maybe they should, seek for help, seek for treatment, like meet a professional. Don't be too pushy. And they sometimes have their own reasons why they don't want to, but when they want to, seek for help, you should be there for them. Maybe as a family member or close friend, you can, bring them to seek for treatment, like meeting a doctor, taking their medications, going for their appointments, or like maybe before, if they don't know where to seek help, you can help them to find a doctor, find a place where they can get diagnosed, or things like that. And for institutions, or for me, I am studying, so I would relate that for institutions. Maybe for, some lecturers, they are very highly educated, but sometimes they weren't educated enough in mental health area. So I think if you are an educator, you maybe should be more educated about this. And for me, I was grateful enough to have like very supportive lecturers where they will understand my condition. So I feel like that thing should be normalized in other institutions as well. So maybe for institutions you can have more counseling centers, or a mental health day maybe. And if you're like a lecturer educator or something like that, maybe if your student are feeling unwell, because mentally unwell, you can give them a mental health rest day, because it is very important, not just physically, but your mental health should be taken care as well. And maybe, in institutions you can have like support groups where you maybe every month you can just like, gather around and talk about more about mental health, so you can be more aware, and educated. And yeah, I think all those things combined could definitely defeat the stigmatization in this country, especially. A lot of people also maybe wouldn't know much about bipolar disorder, maybe this disorder and that. So I think it's a great place to actually share about your condition. So it should be normalized to have a mental health rest. It should be normalized to have a support group. It shouldn't be something that very weirded out about or anything like that. So yeah, I think that's one of what we can do as a society to make bipolar community to feel safer.
So thank you, Sister Arsa. What about you, Puan Anita? Maybe you have some thoughts on mind regarding this.
Which part of it?
You know, how to what as a society can take. We can what are the best way we can help
Mm.
for the survivors to feel safer and more welcome in our society.
Yeah, I think education is really important. So, contact based education. So, if you are aware that you have stigma, which is good because now you're aware, but what are you going to do about it, right? So, I think the first step is seek knowledge, and based education is really helpful where you interact with people with a condition. Because through that interaction, there will be a lot of insights that you're able to gain. So these are one of the things that we encourage a lot at Miasa. Come and volunteer, help us out. That way you're able to contribute to a good cause, but at the same time you're able to gain that knowledge, and people with mental health condition will feel more supported. So we want to empower the community as much as possible. And again, the normalization of these discussions are very very important. So having webinars like today, public discourses, and I feel that the youth, you guys have a huge voice. Leverage on social media, right? Don't abuse social media. Use it in a responsible way where you're able to share all these knowledge and be mindful of your words and language, and that in itself can really help in combating stigma. And of course, speak out. Today, from the sharings and insights provided by Sister Arissa, now you guys understand better. So mental health literacy has improved, but with this knowledge comes responsibility, right? So when you hear or you see your friends being stigmatized or being discriminated, don't be silent. Speak up. Do something about it, because the translation into action, that change in behavior, that continues to be an uphill battle, but you guys can make that change. So these are some ways, which is within your own capacity and within your grasp, right? You guys can make that change. You guys can be advocates. So just by doing all these little things can really impact the society as a whole. So I feel that these are different ways that people can contribute. And again, when it comes to videos or pictures, maybe. Because I remember last year, a lot of pictures and videos went viral of people ending their lives, right? Because there was a lot of report in the media, and obviously there were a lot of videos and pictures made available. Don't make these pictures and videos viral, because it triggers people that are in these vulnerable groups, and it can lead to suicide, contagion, and copycats. So there's a lot of harm. So the only way that we're going to be able to stop all these things is, it comes back to knowledge, it comes back to education. So seek that knowledge. Don't continue to be ignorant in that sense, right? Because it's 2022 now. Information is everywhere. Especially you guys in your generation, right? There's so much breakthrough when it comes to technology. So much information out there. So seek knowledge, learn as much as possible, come from a place of empathy and compassion. That way people with mental health conditions feel supported, and they're able to go through that recovery process effectively, because we never know. Again, mental health condition, it doesn't discriminate, so anyone can get the condition. So if we understand this, I think we will be more mindful, and we will be able to help one another better, because obviously everyone is struggling with something. One of the silver linings of this pandemic, I always say, is now we're able to normalize this. Mental health literacy has improved. People now have a glimpse of what mental health challenges are like. So obviously there is more empathy today. So I hope it doesn't end here. I hope it doesn't become a trend, because it isn't. It's not a trending issue. It is a silent pandemic, which isn't very much silent anymore. It is actually a pandemic of mental health as well. And if we don't do something about it, we are going to lose more people to the condition and to people ending their lives when suicide is 100% preventable, and we can do something about it. And obviously, we all have a role to play, and if we play our roles well, people don't have to die. And it doesn't have to end with tragedy. It can end with successful stories all the way, inshallah.
So thank you so much, Puan Anita and Arisa, for the thoughts. Yes, I believe it is our responsibility. It's our society's responsibility actually to help and to accept one another wholeheartedly, accept for who we are in a society. And thank you so much for advocating people here to be a very responsible, supportive community, society towards one another's well-being. And together, inshallah, we can help to overcome insecurities, struggles for those who battling with their inner self, inshallah. So let's proceed with the Q&A session, shall we? Because I can see there's quite numbers of questions in the FB live. So
yes, hopefully we can answer as many as we can. But
yes,
here
inshallah.
is the first one. Bismillah.
Okay. So first question from our attendees, from Aisha Afrina. So this question is for Sister Arisa. So how do you expect maybe your friends or family to react when you have explosive behavior? Because I have a friend with bipolar and I want to help, but I do not know how to react when they swing mood suddenly. So Sister Arisa?
Right. So I think when you have a friend or family that is having like an explosive behavior where they are very irritated or they doing like very impulsive things, firstly, don't panic. And then if they are in a very dangerous situation where they can harm themselves or they can harm others, then you should definitely bring them to take it a more serious note lah, and to bring them to emergency department. So, but if they are still can be controlled, then I think one of the best ways is that maybe talk to them. But every every people react in different things. So I think first of all, just let them be, and just make sure they are in a safe place. And if your friend is going through it, but you can't be there physically, always like maybe you can text them, ask them how did you feel and what you need to do, because trust me, when you are maybe you are feeling suicidal, you are feeling like you want to end your life, by you if you're by as a friend, if you ask them, it doesn't trigger them, it doesn't make them, oh, I want to end my life right now. It actually makes them feel that they are needed, that someone out there still loves them and wants to listen to them. So you should ask them how they're feeling, if they're feeling really low, maybe what you can do, because everyone needs, maybe some people wants to be just to someone to listen to them, and some people want advices. So I think you should clear that up first, and always support them. If they want to see a doctor, they want to see a professional, bring them there. And at the end of the day, you have to remember that um, you can help them, but if they don't want to be helped, you can't help them. So if you try to help them, if you try to force it on them, it's not going to be a good outcome. Maybe they don't want to be helped, but most importantly, you have to realize that you have your own mental health to be taken care of first. So it would drain you, it would make you feel burned out. So remember to take care of yourself before you take care of others.
I think this is a question suited for Puan Anita. So as a head of department, this is a question by Zuraiza Abdul Hamid. And she asks, as a head of department, how do I be more supportive of my staff who are diagnosed with bipolar disorder, I'm assuming?
Thank you so much, and that's a really good question. Yeah. So how can you be more supportive of your staff? I think what is really important to have an open communication, and open door policy, right? So that your staff feel supported, that they don't feel scared or embarrassed to share with you their struggles, and to be really honest with what they're going through. And I think the first step is to have maybe campaigns in the workplace. That's very important, and also providing reasonable accommodations and adjustments in the workplace. So it could be in many forms. So it could be maybe prolonged illness leave. When people want to take MC, they don't feel um, scared to do so, right? Saying, bringing that MC from their psychiatrist because, they need to go for their sessions and appointments, an example, or providing comfort rooms where people can take time out if they're indeed going through maybe a panic attack in the workplace, or going through overwhelming stress, or battling suicidal thoughts, as an example. Because usually what happens is, when all these different symptoms or scenarios happen in the workplace, usually where do employees go? They go to or students go to the surau, as an example, right? Or maybe to the bathroom, because there's not really places for them. And then continuously having mental health talks in the workplace. It's very encouraging when employees or students know that they are supported in their workplace or in universities, because it encourages and it helps them to reach out for that help. They know that they need to take certain breaks. They're able to have that open conversation. They feel validated. There's empathy. There's compassion. So I feel that being in whatever supervisory role that we're in, is to be supportive, as how we're supportive if the person comes to us and say that they're going through cancer, as an example, right? Maybe that's the best example I can give, that we would come from that place of empathy and compassion, and we would be supportive, and we won't be judgmental, right? So I think it's more about holding that space, listen to understand, listen for emotions, and don't be quick to judge, and don't listen to advice, especially when we lack that knowledge. So it's more of holding space, and just being supportive. um, Give them that opportunity to speak out about it, and you can work on solutions together. I think that's really helpful.
Okay. Thank you, Pranita. This is for our next question. This is from Vanya, and her question is to Miss Arisa, and she asks, when being in an environment that doesn't support your mental issues, how do you seek for help?
Okay. So I think when you are in an environment that doesn't support you, you feel like your friends would stigmatize you and your family wouldn't know much about, mental health conditions. You should know that there is still help for you. There is still help out there. There is still people that will help you out there. So, first of all, maybe you can join groups like Miyasa, where you will know more about mental health conditions, you know how to seek help, and you should know that if even when you have people around you that does not support you, you feel very scared to seek help. um, you should know that you still deserve to get help, even though it feels impossible. So maybe you can go like groups like Miyasa. I think that would be a very good place to start with. Yeah.
All right, I think we have time for one last question from our viewers, and this is for Puan Anita, a question from Hazim. From your experience, maybe in handling people with mental health issues or disorders, what are common factors that cause them to experience those disorders? If you can
Right,
give us
thank
any
you.
insight on that. Yeah.
Yep. Thank you, Hazim, for the question. Again, it's multifactorial usually. There's not like one incident that causes a person to get the condition, but obviously, with this pandemic, it has exacerbated a lot of these symptoms, and usually, it's feelings of anxiety, anxiousness, worry, panic, because of the ongoing uncertainties. Right? It actually overwhelms understanding. people don't really know how to cope. And we see that all these different symptoms and situations, when it exacerbates, that this is and then all these different situations or contributing factors are present, then people fall into getting depression or adjustment disorders or anxiety disorders. Because obviously when the pandemic first hit, right, contributing factors were all there. Risk factors really increased, and because of that, a lot of people were really struggling. And this is not something that is new, because if we look at um, past history, right, where um, when pandemics happen or epidemics happen, or even during war or hunger, a lot of people do fall into having all these different conditions, right? Anxiety, depression, self-harming increased, suicidal behaviors, people ending their lives, people resorting to harmful coping mechanisms, be it drugs, alcohol, etc. So when all these contributing factors and risk factors increases, then it's really easier for people to fall into all these different symptoms. So it could be loss of loved ones that triggered it. It could be loss of jobs, reduction in income, being cut off from your social support, being in isolation for so long. It creates a lot of hopelessness. It creates people feel trapped in that sense. They feel life becomes meaningless. They're not able to have that social support. It cuts them off from their effective coping mechanisms, be it being with family, being with friends, or just connecting with others, or going out with having drinks with friends, or going for a football match, or jogging, for example. So all these different factors in combination have really triggered a lot of these symptoms and exacerbated all of these different situations and challenges that people go through. So not understanding it, not being able to manage it, not having effective coping mechanisms, not getting that treatment early enough, not having a holistic approach. So many things have contributed really. But of course, financial difficulties within the pandemic has been one of the bigger things, obviously, that we've seen. Of course, because when you lose your job, what happens? You're not able to pay for the rent. You're not able to, you don't have work coming in. You feel hopeless. You feel trapped, and you feel that there's no way out and there's no solution. And so this is what, unfortunately, what we've seen.
Thank you so much, Wanita Abubakar. Hattie, anything you would like to add before we move on?
I think all are clear.
All right. So thank you so much to everyone for your questions. I know there were a lot of questions here today, but unfortunately, time is not on our side. So on behalf of Miyasa, I would like to appreciate it if our viewers could take a few minutes to fill out a brief feedback form that I have sent in the chat section, if you can check it out there. There should be a Google Form link that I have just sent, and it would be great if all of our viewers who gathered here today would take the time to fill it out. Okay, so before we end today's program for good, we would like to hear any closing words or final messages from both of our speakers. Maybe Juanita would like to go first.
Okay. All right. Thank you so much, everyone, for joining today's discussion. And thank you so much, Alif and Hayati, our moderators, and Arisa. Thank you so much. You're such a great advocate. And thank you for, sharing your story and your experience, obviously. For me, it's always a message of hope. For those of you that are struggling, especially students, please reach out if you are indeed going through something. Don't be scared. Don't be embarrassed about it, because a mental health condition, a mental illness is an illness, like how physical illness is an illness. There's hope. There is a way out. You can recover from it, even if you don't feel that way, even if you feel that it's so difficult and challenging at this time. Please find at least one person that can help you go through this struggle. There's a lot of help. There's people like us, of course, Miyasa, we're in the community. You can walk in. Many helplines are available. Miyasa's crisis helpline is available 24/7. I'm just going to go ahead and give it out. It's 1-800-820066. So, reach out if you need to. And, we're here for you. You're not alone. Take care, everyone, and stay safe.
Thank you. And anything you would like to add, Sister Arisa, before we end our session?
Okay, I would like to thank Alif and Sister Hayati and also Pananita. I'm very honored to be here to share about my stories and my experience, and I feel accepted. I don't feel, stigmatized. I feel welcome. So, yeah, I hope the viewers and everyone who's watching this will be more educated, more aware about bipolar disorder and how to support them as a community in a society where it's not always kind. But yeah, I hope by now you would know more about bipolar disorder, and just know that most of us, it's like a reminder from what I said. Most of people with mental health conditions, they are a victim of abuse and not the abuser, and you shouldn't stigmatize them because it's already hard enough for us to be in our body to accept what our to actually go through it. And if we don't even have our support, then it's going to be worse for us and it's going to be harder for us. So as a community, I hope one day Malaysia will be, it's normalized for us to talk about mental health. It's not something new. And yeah, I feel really welcomed and I'm very happy to get to share about my experiences here. So thank you.
Thank you. And with that, we finally have come to the end of our webinar, The Bipolar Disorder Perspective. And once again, we would like to express our deepest gratitude to both of our speakers today for taking the time to be with us here today. Although we had quite a limited time frame for this program, I think we managed to go quite in depth and learn so much more about this disorder and those who have to face it, right? And of course, that is the whole reason we chose this topic in the first place and why we really tried our best to make this webinar happen, to make people more aware about this disorder and hopefully fight the stigma against bipolar disorder, right? So we would also like to thank all of our viewers today for tuning in, and we deeply apologize for any shortcomings during this session. And we hope that any mistakes that we made today will serve as lessons to us in the future. And I would like to end this session with a quote from poet Khalil Gibran: "Out of suffering have emerged the strongest souls. The most massive characters are seared with scars." And I think this not only applies to those struggling with mental illnesses or any illnesses in general. I think this also applies to all of us because suffering and pain is inevitable. But what matters is the realization that we are all strong enough to keep going. So that is all from us. Assalamu alaikum warahmatullahi wabarakatuh. And thank you for watching.
Thank you, Pananita and Arisa.
Walaikum
Thank you.
salam wa rahmatullah. Thank you very much, everyone. Take care.
Thank you.
Thank you guys. Bye.